high in improving the community's health, but based on community input and what the community said was important to them. So we started our planning process. And so another show of hands, for those of you that have had strategic plans, how many of you, you go through it and your first goal is like, oh, I'm going to solve all the world's ills, and that's kind of where your goals stay. Or I'm going to solve all of obesity for children 0 to 5. Or, I'm going to solve everybody else's ills that, is over 65. Those kinds of things, where they're big and they're lofty, and you're just like, okay, now what? And quite honestly, that's where we were in our first iteration. In 2015, and I think a little bit was, we were a little tired by then. We'd gone through a CHA, we'd gone through a CHIP, and now we're strategic planning, but we still wanted to solve all of the world's ills at that point. And we put it on paper. We wanted to improve healthy eating. Okay, but we put it there and that was our goal. So realizing that we had a really good framework and we had some really good goals, but we really didn't have a way to implement it. And I think that's where a lot of strategic plans get stuck, is you have all of these great lofty goals, but then being able to really drill it down into really actionable steps becomes the really onerous process. And I will admit, it was very much a resource-intensive, brain-draining, iterative process. But I think it was really important for us to go through that process. So we knew we needed to do something. We needed to do the plan. So, like I said, 2 years later in 2017, we actually brought the plan back to life and said, okay, now we need to be smart about it. So being smart meaning we needed something specific. We needed specific actionable steps. We needed to be measurable, actionable, I don't know what the R is, but time framed. So we needed to start adding all of those very specific activities related to our plan. And one of the things that was really critical in this process is that, and maybe I should back up a little bit, and I probably should have started with this. So kind of to describe my department. So I have a fairly large department. It's usually about 900 budgeted staff, about a $100 million budget. And what I actually really love about my local health department is because I'm in a unique situation where I have environmental health within my health department. I actually have animal control within my health department. And then I have all of the traditional public health things that you would think of. Communicable disease, I run 4 FQHCs, maternal health, immunizations, vaccinations, those kinds of things. So I like to say I have the 10,000 restaurants and the 10,000 homeless pets and then 2 million people in between. So that's kind of the swath of what our department is responsible for. So knowing that I had a lot of human resources out there and really a lot of expertise within the department, I actually went out and we were very intentional about allowing staff to create their own very unique goals and their own very unique action steps related to meeting a particular lofty goal. So if the lofty goal was, I'm going to, address obesity in 0 to 5, we let staff amongst the various programs, and at the lowest level, because they're the ones interacting with individuals, they're the ones interacting with the community. They got to develop what their own particular goals were. They developed their own action steps. They said when they wanted to get it achieved. And they're the ones that actually set the measurable part of it, whether it was a number or some sort of percentage. And that's a really important part of, I think, this particular process is we really tried to drill it down to the lowest denominator. We really wanted staff involvement so that they would own the plan itself. So once we got all of that, and mind you, we hadn't started using our Socrata Open Performance site yet, because we first wanted to really kind of get a sense of what are we going to do and what are we going to track. So once we got to some of those more measurable things, this is when our Socrata Open Performance came in. So what we've actually elected to do, and we did this for several reasons, is we are now putting up all of those goals onto an open performance site, our Socrata Open Performance site, so that you can see what your goals are. You can see whether or not you're actually on track, and as you can see in one of our priority areas around community and environment, We are on track when it talks about increasing physical activity and nutrition. You can see that we need a little bit of improvement in terms of the exclusively breastfed for our WIC clients. But that we've achieved our goal, huge thumbs up on the increased food safety practices. One of the things that was really important being able to share these things is, and I'll use the increased food safety practices as an example. So within environmental health, they started to institute these activities called pep talks. It was like proactive education for the restaurants. And one of the reasons being is what they discovered was that the biggest problem they had with restaurants that were at elevated risk, meaning this was a restaurant that had a lot of major food violations, and we're in this you shouldn't eat here kind of scale. But what they discovered is on their repeat visit, those restaurants weren't getting any better. They were still at that don't eat here kind of scale. And so they couldn't figure out why, because they would talk through them and they'd show them, okay, you have a rat infestation and you don't have any hot water and these are the things you should be doing. But it just didn't seem to work. So what they instituted what were called pep talks. And so what they were actually shorter snippets of very specific things that they could put into place. And when they first started to do this as a way to look at improving these ratings or these scales, what they discovered was they weren't getting the numbers that they wanted. And it was because the talks were too long. The minute they shortened them so that the restaurant owner could very clearly pinpoint very unique things, when they shortened them to 5 to 7 minutes, improvement went straight up. So it was just a very quick pivot to a strategy that they put into place. But they were able to track all of this through the data that we gathered. And the other piece of it too I want to add is, when we presented this data, what I heard from one of the supervisors, and this is also, a really great example, is they said, staff, when we talk to you about doing these pep talks, and you're like, oh, and, we asked you to do these things, that's why. It's because look at the improvement that we can do when we start to make little tweaks into some of our programming. So as you saw in the previous slide, there was an area that needed improvement. So it was the breastfeeding, exclusively breastfeeding for our WIC clients. So we wanted to start evaluating when something doesn't work. And I think, it's important to talk about when we started to market this thing, when we started to market that we were going to put all of this data out for everybody to see, we were really cognizant about ensuring that staff weren't afraid to put it out there if it said it needed improvement. And a lot of that had to do with messaging. Because nobody ever wants to see a bad number. You think you're doing this great thing and nobody wants to ever publish this bad thing. I let them know that I'm a huge proponent of failing forward. You never learn until you fail, quite frankly. You never really looked at how to improve unless there's something going wrong. So it's always about movement. And so you really need to encourage your staff. It's not about the failure, it's about what you do after. Because a number is just a number is just a number. And without context, and without this idea that we're not going to punish you, this whole open performance site isn't a hammer. It's for you to just be engaged with your own data. And for you to think about what this data means and maybe start to think about what are some other things you could be doing a little better. Or how do you start to tweak some of these interactions. And so with all of that in mind, what we actually started doing, and mind you, in this whole time, we've also started looking at creating a culture of quality improvement. So what we tied all of those areas where we were either needed improvement or we were struggling a little bit in terms of how were we going to accomplish these things, we actually created PDSA cycles for them. And if anybody knows what those means, it's kind of a QI process. It's plan, do, study, act. And they were able to do it in short snippets. So we were doing PDSA cycles at 3 months at a time, so nothing really onerous. But even with the exclusively breastfed, so now staff are saying, okay, well, we'll do a quick little PDSA cycle on what we thought would work to get us to a particular number. And they were able to run a PDSA cycle, and they were actually able to identify why something wasn't working. And so now they're in the process of coming up with just a minor tweak and then looking to implement it, run another PDSA cycle, and see if it works. The other thing, though, about the messaging behind that particular number, even though it said it needed improvement, what we were able to show, though, to the staff was within 1 month, their rates actually increased by 1%. And that doesn't seem like a lot, but when you're talking about a county of 2 million people, and I probably do about 84,000 WIC contacts in any given month, that 1% is huge. And that's how you continue to build morale. You know, it wasn't about you haven't reached your goal. It's like, oh my God, look at what you've done, though, in the last month with this little bit. So let's just keep revisiting and tweaking a little bit, and maybe we'll get there. But it was about, no, look at what you have actually accomplished within that 1 month. You did show some sort of growth and some sort of improvement. So by doing all of this and getting it out there and being able to publish it on the Open Performance site, ultimately one of the things that we're also going to do is kind of paint the big picture for them. So we really wanted to make it clear that, you know, yes, this is our strategic plan, these are all of your particular activities, but it's part of this larger vision, it's part of this larger picture. So we're tying in the performance management by doing PDSA cycles through each of all of those goals. We're tying in our community health assessment and community health improvement plan, because all of the goals that we built within our strategic plan tie to something within the community health improvement plan. Ultimately, we have actually 5 priority areas that we're looking to do. The 5th one is around infrastructure. And so we're going to start tying this workforce development plan that we've also been working on into this particular open performance site, so they can see how work is being done through their workforce development plan. And so I want to leave you with just a couple of nuggets in terms of what we've learned through this process. It's all about the people. It has to really start with the people. We started with the staff to building the strategic plan. We started with the staff in terms of letting them own what activities they wanted to include in it as a strategy. Because what we told them is, you're the ones that are most knowledgeable about what's happening in the community. And you're most knowledgeable about what you can control and put into place, and when you can meet it, and what are some of those things that you want to track. So we really put ownership on the staff in terms of the goals and the activities. What we wanted to do also when we started to put it out there in terms of the open performance site is we wanted to make sure they were engaged in it. So how many times have you guys either sent out an email or gotten an email, some random email from somebody high up that's like, oh look, there's this thing, and then it just you get crickets. It gets ignored because it's just yet another email from somebody at the top saying, oh, we created this, go look at it whenever you have time. We wanted to make sure that didn't happen. We put so much time into the strategic plan itself. We put so much time into building out the activities. And then we put so much time into really kind of creating an open performance site where we really wanted them engaged. We weren't going to be passive about the engagement itself. So over the course of like 2 months or 3 months, we actually took this show on the road and we personally demoed it to all of the staff. So when we didn't ask them to come to us, we went to their staff meetings. I invaded their staff meetings for about 15 minutes and actually walked them through the site so that they could see it. So it wasn't just an email like announcing this new site. We showed them the goals. It was amazing when I presented at a WIC staff meeting and they could see all of the work that they've been doing out there public. And even though it said needed improvement, they were really revved up about what can we do next. How can we make sure that we're meeting this particular goal? The other piece of it is, we had programs now wanting to know about what the other programs were doing. When I have 900 staff, all kind of divvied up into 5, 6 unique divisions, it's really tough for one program to ever know what another program is doing. This way, if you're interested, a lot of the programs could actually see what WIC was working on. And environmental health could see what nutrition was working on. And ultimately, environmental health or communicable disease could see what communicable disease was working on. So it was a way to really start to get some of the programs and some of the staff much more involved in terms of what their colleagues were doing. And what I discovered was that there were a lot of instances where they wanted to help. It was an area where they were really interested. It may not have been within their program scope, but they were really interested in what this other program was doing. And so it gave them a way to engage. The other piece of it too is by putting it out there, and so know that because it's on an open performance site, it's open to the public. So it is our strategic plan, because again, one of my biggest issues I think historically around strategic plans is you create it, you do all of these great things, even if you're implementing it, you keep it internal. Like for whatever reason, all this great work that you're doing, you feel this need to keep it within your own four walls, rather than kind of telling the world this is all the great things that we do on a daily basis. So I wanted to make sure the world knew what we do on a daily basis, all of the great things that my staff are doing. So hence why I absolutely put it on an open performance site. And I didn't get to do a screenshot, but behind each of those goals is a huge perspectives narrative about why that particular goal is important, what our strategies are, and how you can get involved. So if you as community, if this is really an area of interest for you, you can get involved in some of these things, because a lot of the things that we're doing is community involvement. And then also, because it's open, I've intentionally let all of my electeds know that the site is open for them. Because oftentimes it's hard enough for me to explain, what does public health do? And I get that all the time, even for my children. They still have no clue what public health is. And I've been in the department since 1997. So I get that a lot. So now, when somebody asks, what does public health do? Right here, this is what we do. These are all of the things that are important to us, and this is how we're being held accountable to you, community, through all of this work, through these particular goals, and on all of these strategies. So a couple of other things, and it was really empowering, I think, for staff to be able to see that all of their work was being really blasted out to the community, and they were really empowered by that. The other thing, by making this open performance site out there, is we were really able to kind of drive decision making down to the lowest level. This was their data. They could see it. They could act on it. They could make changes to it. One of the things that we were very intentional about is with each of these goals, there's an objective owner. They absolutely can go in there and tweak the strategies. They have ownership of it. It's not as if I'm the only one who can press a button to say, change this, change this, change this. They have complete ownership because they're the ones that know best. And so it's a little bit of acknowledgement that you know better. You know how to word it. You should be the one telling the story, and you know how best to track it. So we really lowered a lot of the decision making down to the lowest level so that they could truly act on their own data rather than hiding it. So after we also went through kind of the roadshow with all of the staff, we were very intentional about also doing surveys afterwards. Because, this was kind of, this picture in my head, and this is what I thought would be really helpful, but I wanted to make sure it was actually helpful for the users. Because quite honestly, the open performance site is not necessarily for me. I never really built it for me. And I needed to emphasize that. It's not for me to sit there and stare at it every day and then come in with a hammer if you're not meeting a particular goal. The whole point was for the staff, so that they could see the data, they could see somebody else's data, they could see what strategies everybody else is working on. The whole site was for them. It was not intended necessarily for me as some sort of hammer. But we need to know if that was going to work for them. If this was a good way for us to kind of help visualize the strategic plan, help visualize a lot of their strategies. So again, really, we're very intentional about getting a lot of their feedback. And we got really great feedback. What I love is a lot of the feedback came back saying, hey, is there a way I can get notification of when the data changes? And the reason I'm really excited about that is because that means they're really interested in the data. And they want to see when it changes. And when you're interested in the data, that means it shows they value the data. So how better to start driving data-driven decision-making by making sure people truly understand the value of data. And we're doing that kind of across the board. So it's not just executives making data-driven decisions. It's staff that are able to now make data-driven decisions. And what we've discovered is because they can constantly see it, it keeps them moving. It keeps them always thinking about what can I do next. Because they've all been trained now on how to do PDSA cycles, and they're now taking, taking ownership of that. And so they're running their own PDSA cycles through all of their particular goals and all of their particular strategies. And then I think the biggest thing was when you put somebody's work out there, I think it's such a morale booster. You know, when I say, no, I'm going to tell the world all of the wonderful things that you're doing, what a great incentive to keep doing that wonderful thing. Or even better, to keep doing it better. So it was about constantly reminding them of their contribution into this huge picture, into what it is that the community was asking them to do. So that's kind of our little story and some of the impetus. And you know, if you ever get a chance to go in there, it's health. I'm going to do a little marketing. It's Health Stat San Bernardino. And you can see we only have 6 up there right now. It's not that we're only focused on 6, but as we collect data for it, we're going to start putting up additional goals onto all of those things and strategies and stories and things like that. So that ultimately, our plan is to get anywhere between 25 to 30 goal tiles up there with all of the various divisions included in there, all of their particular stories, and really giving them ownership over the data and really keeping them involved in the strategic planning effort. So with that, I want to thank you. And so I will open it up to questions. Yeah, thanks, Tom.
Oh, I don't know that I need a microphone. So with your goal tiles and all the data you're collecting, are you collecting enough data yet to determine whether it makes sense to co-locate your animal shelters and clinics?
Did you ask whether I should co-locate clinics and animal shelters together?
Well, only if the data represents it.
Wait, is that what I really heard?
Anyway,
that's how performance analysts think.
That's
Right.
got any data on that one?
So right now, my goal of an animal shelter is hopefully to actually release the animals to loving homes. Whether or not my clinic clients would love to take one of those animals, that might be something that we look at is, you know, whether or not yay, you came in for a visit, let me hand you a puppy. And really help to empty our shelters that way. Always a thought.
Looking forward to seeing that.
That will be Tom's last question. All right. I think it's a Southern California rivalry right there. Anyone else have a question for Trudy? Like that's useful? Here we go, Ben.
So I came in a little late. Did you say San Bernardino County?
San Bernardino County.
Oh, okay. I grew up right next door.
Oh, where?
In Diamond Bar,
Oh.
LA County. So anyway, what is one of the issues I've run into in something like you're doing is the upward approval process, not the downward participation process. So going above you, what's the reception like up there for displaying all this?
Well, I'm not sure I asked, quite frankly. Nice. I had an open performance site. I felt it was important to actually be able to do this because I thought, I mean, quite honestly, for me, my commitment is to my staff and the community. That, I think that's the bottom line. And they know that. And they know I've been working with an open performance site on another venue. So I actually have 2 open performance sites. One of them is actually specifically related to my community health improvement plan. So it's got all of the goals that we're working with from a multi-sectoral basis. So education is going to start dumping their data in there. I'm going to dump tons of transportation data. Hopefully I'll have a really rich set of data from public safety and things like that. So they know I've been really advocating for this idea of open performance. And frankly, when we stood this up, the first people I notified was my board, were my electeds, to say, boom, You know, we've been talking to you about our strategic plan, because how often do you actually get a chance to take this book and share it with your electeds? They're not going to read it, even if I sent them hard copies, which I did. The idea that they're going to sift through my hard copy strategic plan, no. But I said, come look at this site, because it's clean, it's easy to navigate, it gives you some very specific things that we're working on, but it also provides the backstory as to why we're doing it. And one of the things that I forgot to mention is, you know, one of the other reasons I decided to go an open performance site for my strategic plan is, you know, one of the things that we got from staff is, oh my God, can I share this with my partners? Yes, share it with your partners. I mean, think about it. Even though I have 900 staff, imagine the reach now I have when I have my own staff pushing this site out to all of the partners that they work with. So now the reach, especially when I'm doing some community level things, is so much bigger. You know, I've always said, I love the people that sit around a table, you know, to kind of talk through issues. I mean, I love you all, but half the time I'm also looking at the network sitting behind you. You know, you're always considering how much you as an individual, what kind of reach I can get because of your particular networks. And so I'm now using my 900 folks to truly expand my reach into the community. But yeah, I've been very, very open with my board. And yeah, I don't think I actually asked if I could put it out, and just did.
Whole concept of permission, just forget it. Recommendation from Trudy. All right, anyone else have a question? Oh gosh. Now, Tom, we talked about this. Okay.
Trudy, do you guys work with the Community Foundation, nonprofit group? They put together a community indicators report.
Yes.
That pulls in transportation, education, health indicators, economic indicators.
Yes.
When you mentioned what you're trying to do with your community indicators report and the data sets and dropping in from education, it quickly made me think of that broader regional report that's put together. I think it might make sense for us maybe to sit down and talk to them together. Because I know that they've done it across the county line in the past, and it might make sense. And I've been talking about trying to make a pitch to do it digitally rather than produce a hard copy book. And so building upon your efforts and our efforts, it might make sense to
Okay, no, that would be great, and that's one of the things that I think we're also really trying to do is sometimes the idea that I need to print out 300 pages in order to make something available. I mean, you know, one of my accreditation measures is, you know, did I make this thing I created readily available? Well, yeah, it's on the web. You know, rather than trying to print out 500 copies of it and get it out to the public. Yes, it is absolutely available. And, you know, you can pull it up from your computer, from your home, from your school, from your library, all of those things. So again, it's just truly expanding the reach for some of this critical information.
I love it. Anyone else have a question for Trudy?
Sure.
Tom probably has another one. He's holding it in. All right, everybody, let's give Trudy Raymundo a big round of applause.